On behalf of the National HPV Vaccination Roundtable, welcome to the launch of Wirion 2020. Large health systems hold the key for achieving the Healthy People goal of 80% coverage for HPV vaccination. Today we'll share how your health systems can help prevent HPV cancers and invite your organization to join us. So I'm Dr. Noel Brewer. I'm a professor of health behavior at the University of North Carolina, and I chair the National HPV Vaccination Roundtable. Among other things, I've developed the announcement approach and an evidence-based training for clinicians on effectively recommending HPV vaccination to parents. The Roundtable's mission is to raise HPV vaccination rates to prevent HPV cancers. We bridge immunization and cancer prevention through our coalition of over 70 member organizations, and through them, their constituents and the greater public. We convene national organizations, experts, and key stakeholders to ideate, strategize, and problem solve. We communicate and inform providers, systems, coalitions, parents, and the public about the importance of HPV vaccination as cancer prevention. We catalyze our members to take action to close the adolescent vaccination gap. For the past 18 months, Roundtable members have collaborated to strategize on how we can better engage health systems to raise HPV vaccination rates. Many of you on the call who are part of large health systems were part of that work. Apologies, the slides are being a little buggy here. Let's see if we can get them to move. There we go. Today, we announced the launch of a nationwide initiative to catalyze health systems into prioritizing HPV vaccination for cancer prevention. Working together, we can prevent 30,000 HPV cancers every year, starting today. Health systems hold the power to close the care gap in HPV vaccination and raise coverage rates for adolescents. Health systems who work with the Roundtable are inspired by Healthy People 2020, and they saw an opportunity to champion a larger health systems movement for cancer prevention. Today, you'll hear from several leading experts. You'll hear about federal priorities on HPV vaccination and how health systems are essential to improving HPV vaccination rates. You'll hear from a clinician champion on how a health system can take on an HPV initiative and key considerations for planning. You'll hear about roles for health systems such as integrated delivery systems, community health centers, medical groups, or private practices, as well as how state health agencies and cancer prevention coalitions can support Wirion 2020. Lastly, we'll tell you how your organization can get involved, to sign on to the initiative, and to access the many new tools and resources we've developed to support our work. On the bottom of your screen, you have a Q&A icon. Please type your questions in the box, and we'll respond to them at the end of the call. So we have a poll here, and I'll need some tech support to make this happen. So the first question is, how long has it been since you've seen the HPV vaccine coverage rates for your health system? So that's popped up on the screen. And so just click an answer, and then it'll automatically register. All right. Are we ready to see the results? I know we're moving kind of quickly here. There we are. Okay, so some people have seen them in the last month, about a third of people, and then another third have seen them in the last year. And then 20% very modestly said, what rates? So that's certainly one specific action we can move toward is looking at our rates. Perhaps we can advance to the next slide. Our first speaker is Admiral Brett Giroir, the 16th Assistant Secretary for Health in the U.S. Department of Health and Human Services. He serves as the Secretary's principal public health and science advisor and is responsible for coordinating HHS's efforts on the administration's efforts to fight America's opioid crisis. He oversees the Office of the Surgeon General and the U.S. Public Health Service Commissioned Corps. His office leads many critical national initiatives, including a new plan to end the HIV epidemic in America, the Physical Activity Guidelines for Americans, the National Vaccine Plan, and a cross-agency effort to improve the outcome of patients with sickle cell disease. Previously, Dr. Girouard has served in numerous leadership positions in the federal government and in academic institutions. Most notably, he was the first physician to serve as an office director at the Defense Advanced Research Projects Agency. As a pediatric critical care physician, Dr. Girouard brings that hands-on, patient-centered perspective to his work as Assistant Secretary for Health, where his primary goal is leading America to healthier lives. Welcome, Assistant Secretary.
Thank you very much, Professor Brewer, and I want to welcome everyone who is on this call with us today. Hopefully I'll get my slides to work like everyone else is a little bit pokey. But for everyone out there, I've been about 2 years in my position as the Assistant Secretary for Health. And literally on the first day I arrived in the office, I identified HPV vaccination, specifically vaccines in general, but HPV vaccination as a leading priority that we were going to attack. And I think we all know the reasons, particularly everyone on this call. I'm having a little trouble with the slides like we all are, but okay, fantastic. So I think we all know that there are about 44,000 HPV attributable cancer cases every year in the United States. I think most of the public is aware of the cervical cancers, but obviously there's a broad array of cancers that are associated with HPV. And I would certainly want to point out oropharyngeal cancer as being a major one in this regard. However, we are unfortunately have to face the reality that although we have a very effective cancer prevention vaccine, that HPV vaccination rates remain truly unacceptably low for adolescents, with only 51% of adolescents who are currently up to date. If you're in a state in the continental United States or Alaska and Hawaii, this is your coverage rate as illustrated by the CDC. There are many states that are doing quite a good job, and there are many states that are doing less of a good job with their own particular issues that are barriers that we all have to work on. These are state and community issues, but that's sort of a picture of the country. Now, since these data just came out literally a couple of weeks ago, and I know we're talking mostly about adolescents, but adolescents grow up into young adults. And if we want to look at the coverage rates for young adults, again, it's really even much less than adolescents. So over the years 2013 to 2018, we've increased coverage of at least one dose from 22% to 39.9%. So obviously we're doing a better job, but that's, you know, that number should be 100%. And the percentage of young adults who receive the recommended course have only gone up from 13.8% to 21.5%. And as you might imagine, there are significant disparities that we face in this regard. If the next slide ever comes up, I think you will see that. Again, from the recent data, for those who have received greater than or equal to one dose of vaccine, the total is on the left. If you look at women, they're generally across the board higher than men, but there are significant disparities with a difference of at least 13% between non-Hispanic white and non-Hispanic blacks. And of course, immunizations for men far lag that number. So what are we going to do about it? We know that HPV vaccine prevents cancer. And of course, the Offices of Infectious Disease Policy, which incorporated the former offices of the National Vaccine Program Office and the Office of HIV AIDS, now in the Office of Infectious Disease Policy, is currently conducting the work to devise the National Vaccine Plan, which is in progress. But although that's going to be released this year, we certainly don't want to wait, and we certainly started right away. Healthy People 2020, which also comes from our office, as well as the new Healthy People 2030, which is in draft, certainly feature the national goal of at least having HPV vaccination rates up to 80% by 2025. And not only would this save greater than 30,000 cases of HPV-associated cancers each year, but a number that I really didn't know until the staff provided in preparation was we could also prevent over 130,000 cases of HPV-associated precancerous lesions of the cervix each year in the United States, which is, when you combine those numbers, it's really a public health imperative that we do a better job. Aha. So the National Vaccine Advisory Committee, who has done tremendous work, and one of my first briefings when I came into my office, provided a number of great recommendations for us. And this has certainly been supported in the evidence that there are a number of reasons that contribute to the low HPV vaccine coverage among adolescents. And the two that I really want to highlight for this audience, which are really two of the leading ones, is that providers are not giving strong enough recommendations for HPV vaccine compared to other adolescent vaccines. And of course, missing opportunities during preventative care, particularly when someone's 13 or 14 or 15, they're not into the doc or nurse or anyone's office every couple of months with an ear infection or cold. They're really maybe only be there once every year or every 2 years. So we really need to seize on those opportunities. The recommendations of NVAC were ones that I think are fairly straightforward if we're going to achieve a future without HPV cancers. And of course, dissemination and implementation of evidence-based practitioner resources, engagement with state health officials. We always need more research, in this case, implementation research, that we can really understand the needs, particularly of rural providers or providers to different underserved communities, technology-based systems. And of course, we've been all over it trying to improve our social media presence, as well as having events like this that we can reach almost 1,000 people right now on the telebriefing. We have basically looked at 3 specific strategies on our own initiative to improve vaccine uptake. Very importantly, community-based strategic outreach, because public health really happens on the ground in communities. Lots of partner engagement and targeted communications. And what I personally think is perhaps the most important is to work with integrated delivery networks and health systems, because so much can be done. And I was so pleased to understand the tremendous examples that we have about how this can actually work in the real world. We've also published a few things. Bob Redfield, the head of the CDC, and myself published this earlier, and I'm sure that will be available to you. I don't think I put the web address on there, but it's something that is on our website that if you want to look up for reference, we'd be pleased to have you have that. So how can health systems help achieve higher HPV vaccination rates? Presumptive recommendations, standing orders, provider prompts. You know, your providers are doing 100 things at the same time while concerned about a sick patient or a person coming in for the health exam. Patient reminder call systems, all these things really work. Other strategies, including team approaches, overall creating a pro-immunization environment, which we try to do every day here. Have a champion. Everyone on this phone is probably a champion within their own health systems, and you should be recognized as such. And of course, reward people for what they do, because there's some tremendous successes. And just every vaccine, you know, you give, you know, that person's life can be saved or changed forever. I met a young woman, we did a video last week, which is on our web. And although she was a survivor, you know, she went through truly, you know, horrible cancer therapy and surgery at a very young age to cure herself from her cervical cancer. And we want to avoid that for everyone we can. So I won't go into this because Kelsey Seabolt, down from my area of the woods in Texas, had a great successes, and I again won't go into it, but really looking at their pre and post interventions, increasing almost by 20% in greater than one shot and over almost 30% in completing the HPV series. You know, really tremendous by doing fairly straightforward things to improve the performance of their providers. And again, these are some of the strategies we have. And again, I'm all about tracking performance. If you don't measure it, you can't really improve it. So really measuring what you're doing and having that as a constant reminder, I think is something we should all aspire to. Another example, which was highlighted on multiple websites, was Denver Health. And my little view screen is blocking some of this, but really looking at their results, it's really remarkable. I looked at their charts, and I put these charts together myself over the weekend just to show, I mean, greater than equal to one dose for females, the national average 57% in 2013, you know, 89.8%. And I think what's remarkable is they had the same success rate in males as they did in females, which is really quite remarkable. Again, their strategies and tactics are listed on the left side, but routine use of immunization registries, having everyone part of the team, medical assistants, you know, it should be a doc, a nurse, a medical assistant, anyone. Have you been vaccinated? Standing orders, of course, because that puts it in a routine flow. I thought this was very interesting to give the vaccines early in the visit. I think most of the time in pediatric offices, that's sort of the last thing out the door, but doing it early in case there is an immediate side effect, you can track that during the visit and don't keep people there much longer. Presenting these vaccines as a bundle. I mean, I don't know why HPV is somehow, you know, put on the side as something that's different. All adolescents need vaccines like Tdap, like their meningococcal conjugate vaccine, their influenza vaccine. This is just part of normal adolescence, and it should be there. Provider level report cards. All of us are overachievers. We don't like to lag our peers. Show me I'm behind by 10% and I'm going to really show you a highly motivated person. And of course, school-based health centers, really important way to intervene. I won't go through these. It's a long slide. You'll have these available to you. And, you know, the number one reason is because we could improve the lives of youths who are developing cancer or precancerous lesions at a very early part in their life. And there should be no more motivation than that. But of course, we will decrease the cost for your system. That vaccine costs a whole lot less than treatment of cervical cancer or of horrible oropharyngeal cancer with multiple surgeries, chemotherapies, immune checkpoint inhibitors, maybe cell therapies that cost $600,000 or $700,000 a dose. So it's clearly there. Improved quality of care. It's what it's all about. We care for our patients. You know, it's horrible for anyone to get sick, but for someone to get cancer that's preventable, it really hurts me personally and deeply. And of course, improve patient satisfaction, that they can know that they're protected against long-term cancers that are, you know, maybe killing their friends or maybe causing unnecessary, or I would say avoidable surgeries. We are going to continue our efforts, and if the next slide comes up. One thing that we've tried to do is really integrate HPV into all our arms. Our office runs the Title X program, and now nearly 3,000 Title X clinics that offer the HPV vaccine are added to Vaccine Finder on vaccines.gov. It's a very good tool, the Vaccine Finder, so you can find nearby providers and locations that offer any of these vaccines. But again, our Title X clinics are doing more holistic care like substance use screening and like HPV vaccination and counseling, because that might be the one time that we can get that adolescent, and we want to make absolute use of that opportunity. We have HPV vaccination resources. that you can use, again, on vaccines.gov, an HPV promotional toolkit. Use the hashtag on social media. I've been all over that. And please follow me at HHS_ASH and at HHS Vaccines. Follow all of us. We'll be tweeting a whole lot about cervical cancer prevention, HPV vaccines, and really all vaccines, and particularly now including flu. We're all concerned about the novel coronavirus, and we all should be concerned. But remember, we've already had hundreds of thousands of cases, actually over 1 million cases of flu, with 100,000 plus hospitalizations and thousands of deaths from influenza. So as we concern ourselves with coronavirus, make sure we get the flu vaccine. It's still our best protection. And finally, there I am. Again, I want to thank everyone for being on the call today. I wanted to get through this material, and I wanted to present it to you to provide sort of a factual basis and some strategies for us. But again, I'm appealing to all of you. I ran a children's health system, Children's Health in Dallas, as a chief medical officer. I, of course, worked in a pediatric intensive care unit for all my early career. And now we're really all here to do as much as we can for public health as possible. And this is sort of like a no-brainer. It's like falling off a log. If we could prevent cancer through vaccines like HPV vaccine or hepatitis B vaccination, it's really such a great opportunity and privilege to be able to do that. So I am personally here, willing to work with any of you. And again, thank you for your attendance at this seminar.
Thank you very much for that outstanding presentation. So a couple of things stood out to me during the presentation that I wanted to highlight. One is that the cost of HPV disease annually is in the billions of dollars. The second is that all states are below the Healthy People 2020 goal of 80% of vaccination coverage. That's quite a missing gap. That's large. Because that Healthy People 2020 goal is tied to HEDIS measures, there's also money on the line for large healthcare systems. Finally, he mentioned involving the entire healthcare team, including medical assistants and nurses. The essence of the idea is having people practice at the top of their license. All right, so let's move on to our next poll here. What is the best description of HPV prioritization in your organization? HPV vaccination is a system-wide goal, implemented differently at each site within our system, or not yet a performance improvement focus in our system. So take a moment to answer that poll. All right, Nikki, let's go ahead and put up the results here. So for roughly half of the folks on the call, it is a system-wide goal. For a third of folks, implemented differently at each site within the system. And then for some folks on the call, about 14%, 1 in 7, it's not yet a performance improvement focus for the system. So that's also an area for growth, and also it's an area for growth to figure out how to take those goals and to establish systems and processes that support them. Okay, so I'm ready to move forward, and maybe you can move forward, Nikki, move the slides forward, and I'll do the introduction. Great, thank you. Dr. Mazzoon is the managing physician for immunization practices at Kelsey-Seybold Clinic in Houston, Texas, that the Assistant Secretary had been mentioning. She earned her MD at the University of Texas Health Sciences Center at Houston. She has led efforts in her health system to improve HPV vaccination over the past 5 years. She's been an absolute champion for this work. Please welcome Dr. Mazzoon.
Thank you. And my slides are not advancing either. So,
welcome.
There we go. Welcome to the crowd, right? So Kelsey-Seybold is a large multi-specialty group practice in the Houston area. We have over 400 physicians and over 20 locations. And we were the nation's first accredited ACO. Our focus is on capitation, but about half of our patients are fee-for-service, and we try to treat all of those patients as if they were capitated and control population health as much as we can. Our system makes cancer prevention a priority because we want the best outcomes for the entire population we serve, and population health is an area in which we generally do pretty well. Also, historically, we've been early adopters of vaccines, for example, the high-dose influenza vaccine when it first came out and others. So we were an early adopter of HPV vaccine. Advanced twice. So in Texas, as I'm sure you're aware, there was a strong backlash to our governor's mandate of HPV vaccination in middle schools when it first came out. So we all know that school mandates for HPV vaccination would probably be the ideal way to deal with this low vaccination rate across the country. But these are currently a non-starter. When the vaccine first came out and Governor Perry's mandate was withdrawn, it really increased the anti-vaccine sentiment in the entire state of Texas. And so I'm also involved with an advocacy organization, the Immunization Partnership, that's here located in the Houston area. And this is just a non-starter in our legislature as well as in the legislature of states across the country. So at Kelsey-Seybold, we adopted the use of HPV-4 early on and switched to HPV-9 as soon as it came out. But we made the same mistakes as others, linking the vaccine to sexual activity and having a whole conversation with the parents about, how the illness is transmitted and distinguishing it from recommended vaccines from required vaccines. And so we basically were inviting refusal and increasing the anti-vaccine sentiment, I think, among parents. And I have a kind of a story about that. In my immunization advocacy, the interesting thing was that we had a group that was advocating at the state capitol for adolescents to be able to consent to their own HPV vaccination if they were sexually active. And that actually got the anti-vaccine people out against the legislator who introduced the bill. But while we were advocating for it, I was teamed up with a group of 4 college students, all of whose parents had refused the vaccination at their early adolescent visit, and all of whom, 2 of whom had parents who were physicians who refused the vaccine. And that just shows how strong our negative discussions about sexual activity and the way this virus is transmitted can influence parents to make the wrong choice here. So we opened our own cancer center several years ago, and it was an opportunity for us to sort of step back and take a new approach. And we sent letters out to our entire patient population announcing the opening of the cancer center and celebrating by encouraging them all to consider HPV vaccination for anyone in their household who was in the age range to get it. And our strong anti-cancer message was loud and clear at our celebration of the opening of that center and in the media information that we passed out. And since that time, we've invited special speakers to the PD and OB and other department meetings on cervical cancer and encouraged all of our providers at their department meetings to give this vaccine. We've disseminated the CDC materials that were spoken about earlier on how to make effective recommendations to all of our providers, but particularly pediatricians and family medicine physicians. And we've done emails and webinars focusing on this as well. And I'm sure many of you are aware there's a nice app that you can get on HPV vaccination recommendations that allows you to practice within the app how to make a strong recommendation. So we push that out to our providers as well. And we've been presenting vaccination rates on all kinds of vaccines to our providers for years, but we really made a special focus on HPV vaccination rates, both divided by male and female, and also initiation rates as well as completion rates by age 17. And we provide ongoing consultation on ways to improve vaccinations at various department meetings, focusing on things like empowering the nurses to offer it under the standing orders, even if the patient's in your office to see you, and bundling recommendations. And most recently on starting vaccination at age 9, for which we got a lot of kind of negative feedback from the providers to begin with, like, that won't work, and really it's too early, and, you know, a lot of concern. And what's been interesting is that we did a maintenance of certification project on HPV vaccination. And on the discussion board, it's been very interesting to see how many providers have actually started implementing it and been pleasantly surprised that there's absolutely no pushback and a much greater acceptance when you start at 9, because they, of course, don't bring up sex with a 9-year-old in the office the way they might have with a 12 or 13-year-old, and I think it helps them remove that from the discussion. So we are also, oops, that's not what I intended to do. There we go. So we're also encouraging our family practice physicians and internists to be sure that they're offering to the 18-year-olds when they switch practices, for those whose parents rejected vaccination earlier. So best practice alerts have been implemented for both the 9-year-olds and also for the 18 to 26. So now our best practice alert starts at 9 rather than starting at 11. We've also had a wonderful ongoing collaboration with industry to review our quarterly rates for completion by 13, and they have offered speakers to all of our sites to encourage timely and effective vaccine recommendations and to really discuss, you know, the cancer prevention angle. We've made presentations to our Nurse Practice Council and taken this training roadshow to all of our clinic locations. So our next steps are to focus on completion by 13, because we had been measuring 13 to 17. And the reason we were measuring 13 to 17 was the National Immunization Survey for teens really holds that whole group. So we were doing that to benchmark against national rates, but completion by 13 rates are now available as well to benchmark against. And we're also giving more feedback of their overall rates of vaccination in patients seen quarterly. And so that a lot of providers will give you pushback about their vaccination rates not really being as low as what you tell them they are, because they're only able to vaccinate the patients that they see. So our dashboards are really a missed opportunity rate. So of the patients they've seen that quarter who were in the age range that could have been vaccinated and who are not full, we tell them how many are fully vaccinated and how many are still missing doses. So they can see that they also have missed opportunities, and that has really improved their receptiveness to having the nurses screen for needed vaccines and to really take action at every visit, not just at preventive care visits. I think it's really important that every system have a managing physician for immunization practices, and you can certainly give them a shorter title. The length of my title is really kind of annoying, but really having someone who really puts immunization on the map for the administration of your clinic is really very helpful. My role includes a number of things, including reviewing immunization policies and standing orders and keeping them up to date, initiating reminder and recall messaging to patients, and making sure that that's an ongoing process, monitoring rates for all vaccines, childhood vaccines as well as adult and adolescent vaccines, and being the vaccine answer person for your organization. So everybody knows the CDC has a great phone line that you can call and ask questions, but it really is helpful to have a physician or two designated within your clinic who can, you know, answer the question of what do I do? Do I need to repeat this vaccine because some of it didn't get into the arm, or, you know, all those questions that we all get on vaccine administration. It's helpful for them to have one person to focus on. And I think it's important to have somebody supervising the education and immunization staff and making sure that there's an immunization champion at each site, which is something that's really helped us out. So our immunization nurses really are empowered, particularly during flu season, to be the champion of immunizations and providing immunizations at every opportunity. And then the other things, that we've done is implemented these national best practices that were spoken of earlier, and providing feedback to every department on the rates of all their immunizations, with this special focus on HPV now. Our best practice alerts have been a really great asset, so it depends on your IT system, but our system allows our practice to modify best practice alerts, and that's how we were able to put one in at 18 to 26 and also put one in at 9. And we do on-hold messaging talking about various vaccines. Right now it's about flu vaccine, but in the past it has been about HPV vaccine. We're currently replacing our mail and telephone reminders with MyChart messaging. If you have a MyChart option in your EMR, it's really important that people get signed up for that. So fortunately, our system has done a great job of getting our patients to join the MyChart system, and so that's been able to reduce costs because we don't have to do as many mail reminders and telephone reminders. And our dashboards are electronic, the dashboards that provide physician feedback as well. So our lessons learned are that, it takes lots of different approaches and lots of repetition for success. And it's important to measure your change in a variety of ways to help the physicians understand how they're doing. So we measure by missed opportunities, by overall completion, by initiation, and by those who are vaccine naive at age 18. Those last two are actually where we're headed. We haven't actually been measuring those, but that's where we're headed. And it's important to understand that your quality and clinical education departments are going to have competing priorities. So to set up your system changes that are ongoing is really helpful. And again, to have that managing physician to kind of keep prodding, if it doesn't seem like things are happening, to keep making it a focus. And we also report those rates to our committee that manages our medical improvements and our nurse practice councils as well. So we benefited by having a maintenance of certification opportunity for our physicians. All of our family medicine docs were interested in this. Our pediatricians were interested in this. Everybody has to get maintenance of certification. So if your organization is able to provide MOC credits, consider focusing on HPV. And for your information, we have a showcase on the things that we have done that's available through the roundtable. Thank you.
Thank you, Dr. Mazzoon, for that outstanding talk. There were several things that stood out. One is that you were quite humble in what you talked about, but you were relying on evidence-based best practices, including having providers make announcements that the children are due for vaccines that presume that their parents are ready to go, bundling HPV vaccine along with meningitis and Tdap vaccines, and then framing the vaccine as a cancer prevention. Those are all outstanding approaches. You also mentioned systems approaches and giving feedback on rates, standing orders, and reminders. We move to our next speaker, who is Dr. Melinda Wharton. She is Director of CDC's Immunization Services Division in the National Center for Immunization and Respiratory Diseases. I think of her as our nation's leader of vaccine implementation efforts. Her budget includes half of the vaccines that are purchased in the United States. And she is a tireless advocate for vaccination. I see her show up all over the place. Given her senior role, I honestly don't know how she's in so many places at once. And we're very grateful that you're with us today, Dr. Wharton.
Thank you, Noel. So we've already heard about why HPV vaccine is important for protecting our patients from the cancers caused by human papillomavirus, and how health systems are key organizations to help us accomplish this. Nationally, only about half of kids 13 to 17 years of age have received the full age-appropriate series of HPV vaccine. Compare that with rates for the other vaccines that are recommended at this age. The tetanus, diphtheria, and acellular pertussis vaccine and meningococcal conjugate vaccines were both recommended right around the same time as HPV vaccine was recommended for girls, but coverage for those two vaccines is much higher, now approaching 90%. Every adolescent who got a dose of Tdap or meningococcal conjugate vaccine could have started the HPV vaccine series. They had a visit at which vaccines were given, but only 68% of kids got at least one dose. And as we see here, coverage with the complete series is even lower. We're failing to protect our children from future HPV cancers and precancers, but the good news is, as you've already heard, we do know how to do better. We just heard a great example from Dr. Mouzon, and health systems are particularly well positioned to take this challenge on. That's why I'm so excited about today when we're asking health systems to make improving HPV vaccination a priority. What are your system's HPV vaccination rates? You can look at complete series or up to date by age 13 or at the series initiation rates. How many of your eligible patients haven't gotten any doses at all? And is there a difference in your system between boys and girls? These data will help you identify strategies to improve. For example, if a lot of kids are starting but not completing the series, scheduling an appointment for the return dose when the child gets the first dose can make a big difference in coverage, and so on. But here's the big question. Does your HPV vaccination rate really reflect your organization's commitment to adolescent population health? In many places, I'm guessing that the answer is a resounding no. And again, the good news is that we do know how to do better. That's why we're working with the American Cancer Society, the National HPV Vaccination Roundtable, and other partners to issue this call to action for health systems to commit to improving HPV vaccination coverage in 2020, and we hope you'll join us. We're in 2020 as a 12-month initiative to catalyze health systems to work collectively toward raising HPV vaccination rates to 80%. This is all about preventing HPV cancers through increasing HPV vaccination rates, and we hope that all of you will join us. One of the most important steps in improving HPV vaccine coverage at the health systems level is the commitment of leadership. That's why we hope that leadership will be engaged. HPV vaccination initiatives are more impactful when they have strong leadership support. Leaders can make improving HPV vaccination an organizational priority and identify opportunities to advance key adolescent immunization performance measures like the HEDIS measure for adolescent immunization. So here's what we're asking your organization to do. Make the We're in 2020 commitment and sign on to the initiative. Determine your baseline HPV vaccination rates for adolescents by age 13. Join us in this national effort by working with us to raise rates, aiming for 80% of both boys and girls. Look at your clinic practices to make sure that everyone is working together to vaccinate your patients to prevent HPV cancers and protect adolescents. And set up a performance improvement goal to deliver 2 doses of HPV vaccine to all your adolescent patients by age 13. And you can do even more. You can share your baseline coverage rates as well as your mid-year and end-of-year progress updates through a short online form. We'd also love to see you share your progress on future webinars, on social media, or through other channels. Your institution can sign up at the URL that's here on the screen. We hope you'll join us in protecting our young people from cancers that can be prevented by HPV vaccination. And we're also calling on coalitions and state health organizations to help us expand the reach of this initiative. For those of you who are in immunization or cancer programs, or the coalitions that support those programs, here's what you can do. Identify health systems that serve adolescent populations. Leverage opportunities to meet with those system leaders and make the case to prioritize HPV vaccination. Encourage systems to sign on to the We're in 2020 commitment. Share evidence-based recommendations and best practices. We know how to do this. The National HPV Vaccination Roundtable has great resources that you'll hear about in a moment. No one has to reinvent any wheels. There are a lot of great resources available. Follow the HPV Vaccination Roundtable on social media or through their website for updates. And finally, connect health systems to local partners for support. If it's needed, there's help available. Thanks so much for joining us. I'm excited to see this launch, and I hope you'll join us, and together we can protect young people from these cancers.
Thank you, Dr. Wharton, again for another outstanding talk. Some of the key points are to involve leadership. that the health systems that I've seen who have been most effective have involved their C-suite leaders from the very beginning and then moved forward with their projects with their appropriate implementation folks. Also, there are tremendous amounts of resources available on the CDC website, as well as the materials we're linking to here through the roundtable. There's nothing that you need to invent. So we're in our final poll here. How likely is your organization to join the We're In 2020 initiative? Very likely, somewhat likely, unlikely, not sure yet. Okay, so let's look at those results here. So we have half of you who are ready to do this. So we have over 900 people on the call, so that's a lot of action out of today. Thank you so much. And then we have another 31% who are ready to go as well, somewhat likely. And then some folks are thinking about it. So if there's anything we can do to help you go from somewhat likely to being ready to go or not sure yet to being more active, then please let us know. Our final speaker is Jennifer Nkanga. She's Director of the Health Systems and Provider Engagement for the National HPV Vaccination Roundtable. You may recognize her as the originator of HPV Yoga. This is a video that has been seen all over the world and went viral. Welcome, Jennifer.
Good afternoon, everyone. It's a pleasure to be with you, and we're so very excited to share this rollout of We're In 2020 with you. We are getting short on time, and so consider this the Oprah part of the show, where we give you this treasure trove of free, wonderful resources to support your very important work. 1 year ago this month, there was a group of us on the Integrated Delivery Systems Task Group who met in person for wonderful barbecue and camaraderie in Memphis at St. Jude Children's Research Hospital. But our mission was very serious, and it was to come up with an action plan for how we as an organization could better engage health systems. And the outcome of that gathering was a plan to develop what we call our influencer toolkit. So that toolkit we are unveiling today. It is a brand new webpage that is a curated collection of resources to support your organizations in this work. You do not have to join We're In to use or access these resources. These are for all health systems to use. So let's briefly take a look through these. In the next 24 hours, I'm so proud to announce that we're releasing over a dozen different videos with national thought leaders such as Dr. Wharton, who we heard from just prior, Dr. Elizabeth Siemens from AMGA, folks who really understand the impact on population health, public health, and how we can use these clips both to influence our leadership as well as educate our care teams. There's many short topical videos, most 1 to 2 minutes long, that are easy for you to use and integrate into your work. So not only are these available on our health system page, but here you'll see a screenshot of the Roundtable homepage, and there's a link to our YouTube channel recently launched, which includes a series of different playlists, including one that will be filled out for health systems in the next 24. Also brand new and live as of this weekend are 2 key resources to help support many of you who are new to this work and wanting to initiate an HPV priority within your organization. So the first deck is the why health systems should prioritize it. And it includes the case for population health, the most recent evidence on effectiveness. It outlines the ACIP guidelines, and it issues the challenge that you heard from Dr. Wharton for systems to self-evaluate. The second deck is the how piece, and this is really how you put the systems changes into place for implementation. These include supporting social media graphics. There's all different kinds of supporting resources for these pieces. Many of you may already be familiar with this suite of resources that we released in early 2018, but we've provided an update last fall to make sure that all of the links were current. These are action guides for different professional roles, as well as system types for everyone to be an HPV champion. So they, as we saw in earlier slides, they lay out evidence-based interventions and promising practices. and link to the resources of our 70+ member organizations. I also want to call out here specifically that there is a guide for office administrative staff, because as we've heard, there's a place for every team member to be an HPV champion and to be on the same page. So we heard from Dr. Mazoon. Kelsey Siebold is one of a small series of health system showcases developed. These can save you a lot of time and effort if you're starting with a new or trying to expand from a clinic or practice site to a larger system initiative. It can save you effort from their lessons learned as early adopters. It also ties back to the action guides and outlines key steps that they took in their own process. Here we also have many links to educational opportunities. You'll find on the health system page a very, very robust section on staff education and resources that it's very, very rich and very deep. Here I've just showcased two, one including Noel's work with HPV IQ, an outstanding site for quality improvement initiatives around HPV vaccination, and then a brand new MOC program that AAP has released on the HPV vaccine that is at no cost. So that link is will be posted in the next 24 hours as well. Outside of health systems, please be aware, if you're not familiar with our resources, there is also a very broad resource library with over 250 different materials that you can sort by audience type as well as material type, and that link is also here. So very quickly, for those of you that have decided or are going back to your leadership to have this discussion about WARN, this next section is particular to organizations that sign on for this 12-month initiative. So we will be offering a series of 2020 webinars. The next will be at the end of February. We'll be looking at how you go about finding your baseline data and what are those best evidence-based interventions. In May, we'll be talking about back-to-school vaccination, and then in early fall, looking at our collective progress based on your progress reports. And then in early 2021, hopefully celebrating our collective progress and recognizing high achievers. If you sign on to WARN, you will also be able to download a quick start guide that includes links to, it's basically a promotional toolkit with newsletter articles, e-news content, patient portal content, as well as social media graphics, PowerPoint templates. So that is a handy guide. We also have a brand new letter posted to help guide your organization. So this is a document you can print off today, leave this webinar, and take back to your leadership or your population health team and look at how could we be part of this. And it outlines the 6 steps. Organizations that do sign on will verify you're joining the initiative and send you a certificate of commitment to be part of this. So you'll look for that. And we are also launching a brand new LinkedIn group to make sure that there's networking opportunities so we can all learn from each other, connect to each other, and share resources. So this is a group you have to request to join. And again, we will post all of these slides so you'll have all of these links. So many, many benefits there, and for the sake of time, I'm not going to go through all of these, but we do want you to know that we will give shout outs based on progress, but that will be up to you as the joining organizations as to which information you want to share. But we do ask when you submit that form, we give you the option, if you sign on, share your logo with us. We want to give you a spotlight. We'll showcase those logos on the WARN page. We'll put up a list of organizations that joined. And then again, in early 2021, we'll have a Hall of Fame to recognize that level of progress. So with that, there's the treasure trove, quick run through. So Noel, I'll pass it back to you.
That was speedy and terrific. Thank you, Jen. So the final poll question is, do you have do you plan to use any of today's resources to accelerate changes in your health system? And while you're answering that, I'll point out that there are a lot of benefits to taking action around HPV vaccination, benefits to systems. One of them is to reduce costs. Another is that there are quality metrics, as I mentioned before, that are based on HPV vaccination coverage rates. Many people on the call have done work in their own systems to help meet those rates. And then finally, increases in satisfaction are very substantial. the increase in patient satisfaction for having a broader range of services, but also delivered in a way that sets them at ease. That also leads to greater provider satisfaction, potentially reducing burnout when they learn how to recommend HPV vaccine effectively and are in a context where that's not a big drama. All right, so we have about 2/3 of folks who are ready to go and use some of these, and many others who are also going to use some of the resources that they've seen today. So we're moving on to the final couple slides here, and I'm just going to have maybe Nikki, if you could move these forward, that might just simplify things. So this is the engagement roadmap, and you'll have that available to you. Basically, we're asking you to join, to get recognized. We'll be happy to put you up on the website or not, to learn together. This is a learning collaborative. To access the curated resources, that number 4 is just a whole world of things that are amazing that you can go get access to. We also have a LinkedIn group and other forms of online interaction, and of course, please do share your progress. Final slide. We're now at the Q&A period, and the link for accessing the tools is there in case you're curious. And do we have time for maybe 1 or 2 questions, Jen?
Yes, indeed. And Sarah is going to pull out a couple questions from the Q&A pod for us.
Yep, and we have a lot of questions. We will answer all of them on the webpage since we don't have time. So I'm going to stick with the ones focused on We're In. So to clarify, is it appropriate for state and local health departments to sign up, or would it be best for them to identify health systems in their area and really encourage the system sign up?
Excellent question. And I would say, when you go back to the slide deck, look at that slide from Dr. Wharton that outlines that. It really is the place of state health departments and coalitions to help issue this call to action in your own state with those health systems. We need your help to activate them. We don't have that reach. We need your assistance, and we need to help systems know about this initiative so that we can really get broad coverage. I know Sarah shared with me before the call, we actually have representation, I believe, from every state, Puerto Rico and Guam. Sarah, is that correct?
Yes, that's correct. At least people who registered. We're not sure if they're online.
Excellent. So we need this kind of broad penetration and as well as your support. So we have left it open. So yes, your organization as a state health department, for example, could sign on, but we're very clear that the focus of this is for health systems because that's where we have to get the shots in arms and deliver through those systems.
Great, and we'll do one more brief question and brief answer.
Another question was around the benchmark of completion by age 13.
So we focus on that age 13 because that's where we have the evidence for HPV vaccination being effective. We know the vaccine is more effective at younger ages for a couple different reasons. One is that kids are less likely to have been exposed to HPV, and also younger children mount a more vigorous immune response. Those two things work together. Of course, the vaccine is effective at older ages, even up through age 45, but the focus nationally is on 11 and 12-year-olds. Okay, we're going to wrap up. I thank you all for attending the webinar today. HPV vaccination is a cause that is close to many of us. Personally, I lost my mom to cervical cancer. I believe she'd be alive today if, as a girl, she had gotten the vaccine. So this is something we can do for all of our children, for the nation's children, to help them be healthy, to have children, to see their grandchildren. This is very important. So thank you all, and good luck with your organizations, and we're hoping that you're in. This concludes our webinar for the day.